Well, good afternoon. My name is Martínez-Monche. I'm the former director of a program called OTOTECH. We have been working in this program for the last 3 years, and we have developed a technique based on electrical stimulation to treat inner ear problems. Okay. First of all, I would like to make a brief introduction on what are radiofrequency and their applications in medicines. What do we expect on radiofrequency when we treat different tissues? The aim of radiofrequency is to reach a tissue with a biological active wave in order to produce some changes on the electrical and chemical equilibrium on each of its components in order to modify the activity of damaged tissues. Well, here we have some examples of different radiofrequencies we have been using for many years. We all know the xenon radiofrequencies for treating turbinate problems, the electrical cauterizer, defibrillators, and so on. We can go on and on with surgical and medical different ways of use radiofrequency to treat different parts of the body. And what do we do? What is the transmastoid cochlear electrostimulation? Well, the isolated anatomy of inner ear has given us the clues and the path to reach the organ, the inner ear. For us, the most effective way to produce biological changes in inner ear structures is the production of an electromagnetic field applied on the mastoid area. And for years, there are many different works that have been trying to prove the effectiveness of radiofrequency treating, above all, tinnitus. And they tried in many different ways. On our revision for the bibliography, we saw that most of the cases, the outcomes were good enough. But in most of the cases, the technique was difficult, if not a kind of surgical technique, to be applied. So it was a difficult technique. In our project, we present a new way to introduce a highly effective electrical wave to the mastoid structures in what we think is a simple and easy way to reach the cochlea. Well, this is the medical device we have been using for the last 3 years. It's a radiofrequency transducer. You see, the pointer is here. This is the radiofrequency transducer. It's obviously it's CE certified. So we passed all the electrical tests that the community asked to pass. It's manufactured in Italy. I'm from Spain. I'm from Barcelona. And we can see the console. This is the earth. And these are the 2 electrodes that we apply on the skin of the patient. And well, this is one screen when it's turned on of the different programs for the treatment. Well, our protocol consists in 15 sessions. Each session takes about 15 minutes. 5 of them are made with one of the electrodes, and the other 5 with the other 10 with the other electrode. And we have to leave at least 24 hours to let the inner ear rest between sessions. So, as we have seen for the last years, it's an easy to apply technique, it's non-invasive, and it doesn't interfere with the normal life of the patients. And when respected the intervals between sessions, it has an accumulative effect. It's pain-free and it requires no additional medication. And we saw that there were no side effects during all these years that we have been using the technique. Here we will present now a retrospective observational study based on our accumulated experience of the last years. We follow the normal protocol in order to study the patients with tinnitus. We made all kind of audiograms, brainstem auditory evoked potentials, tinnitus test. We like more the numeric scale. For us, it's much more easy to give us a quicker information about what's happening in the inner ear or with the symptom. Oh, sorry. Okay, the study has been conducted by a clinical research organization with a random sample of 304 patients with an average age of 58 years. The 35% were women, 65 men, and we treated either bilateral or unilateral tinnitus. A very, very important data that we saw in our studies that the 97% of all the patients we studied, we treated, suffered of a pathological hypoacusis associated with the tinnitus. And obviously, this hypoacusis is more evident on the higher frequencies. Well, what happened with tinnitus? But what happened first with the hearing function, which is really related with tinnitus, as we think. In independence on tinnitus final result after the therapy, half of the patients treated with an associated hypoacusis presented an improvement of 10 or more decibels in 3 or more frequencies on the final audiogram, which are this group. But we have a very interesting group of 5, it's not very high, but it's a number of 5.8 patients with clinical changes on 7 frequencies on the audiogram. 8.5, 12.6, 9.9, so it's very interesting data. During the sessions, we had some changes. The treatment takes about 2 months and a half to 2 months to be completed, and during these 2 months, we asked each one of the patients before the sessions about the intensity on the tinnitus by a numerical scale, which is very quick. And we saw that the 83% of patients refer a decrease on the intensity of the tinnitus on at least 1 session, which didn't mean that they will have, or they would have a reduction or disappear of the tinnitus at the end of the therapy. Also, during the sessions, there were at 16.5% of patients that the tinnitus began to fluctuate, to change. 1 day up, 1 day down, 2 days down, 1 day up, depending on each case. But it meant for us that during that period of time, the treatment was not perfectly consolidated and cells didn't absorb